Have you ever had a medical question but you were too afraid to ask your personal physician? Well, Dr. Lisa Fitzgerald is tackling medical misinformation and common queries with a Dr. Lisa on the streets. Take a look. Dr. Lisa, thank you for joining us. I want to first get into kind of the idea and the motivation behind Dr. Lisa on the street. What was that, the idea behind starting that?
Yeah, well, first, thanks for having me on today. I've been thinking about Dr. Lisa on the street for many years. I was thinking about it many years before I started it because I was on a community panel, and after the meeting, a gentleman walked up to me and said, "How does someone like me access someone like you on a regular basis?" Now, this person had a doctor, he had health conditions, and he was taking medications, but he felt he really needed the information broken down in a way he could relate to and understand. And so after that encounter, I started quizzing my own patients about whether or not they understood their doctors and realized this is a universal problem and wanted to do something about it. So I had found a videographer and we took to the streets and just tried to talk to people and see what would come of it. And that's when Dr. Lisa on the Street was born.
Wow. I imagine, because you do kind of sometimes feel so rushed, or like, I still had another question, you think of it later. What do you see as the value of when you are able to get in front of someone, especially when it's an underserved community?
You know, I like to tell people having a relationship with the healthcare provider is just another relationship you have to manage. And so some people just want a no strings attached relationship to ask questions about their health. I've had people say, well, I don't want to ask my doctor because I'm embarrassed or I feel ashamed. I feel like I should know the answer. And that breaks my heart because that's why we're here. But sometimes people feel, as you mentioned, rushed, but also feel like they're being judged. And so on the street, because I don't have a relationship with folks, they tell me some very intimate details about their health and even their lives. And that's what's really helped me formulate the way we approach our content delivery on Grapevine Health.
I felt like through the pandemic, we also saw like some of those common misconceptions coming up about distrust in medical providers. Do you hear a lot of those out as well?
All the time, but really before the pandemic, this was a prevalent problem, mistrust and misinformation. But the pandemic really shone a bright light on it. So I think, you know, we want people to tell us what they're hearing. And so what we are hearing is people don't understand all the information coming at them related to COVID-19 and the pandemic. And I'll give you an example. Someone asked me, if my COVID-19 test was negative, why should I bother getting vaccinated? So that helped me understand the depths of misunderstanding because we are not taking time to help people understand the difference between getting tested and getting vaccinated, how they may or may not be related. So I think our approach to helping people address misinformation is just first listening intently to the question and then answering it in a very non-judgmental way. And sometimes with examples or analogies that bring it home or make it much more relatable for them. Like saying the vaccine, even though you're vaccinated, you can still get COVID. So it's like a bulletproof vest. You can still get shot, but the vest protects you from death. So using, you know, relatable analogies like that seems to help a lot with the misinformation and mistrust.
And it helps us to actually understand what you are saying. Dr. Lisa, thank you for doing this and thank you for joining us today.
Thank you for having me.
You can find Dr. Lisa and Answers on a street near you on YouTube and most social media apps.